When we think about expanding our circle of care, we often think about the different types of places where we might find care. And there's kind of four main buckets. The first bucket is home health, which is covered by the insurance with a doctor's order and is short term, specifically after a hospitalization or an illness. Physical and occupational therapy come and work with a patient in their home and potentially have a bath aide or someone to come help with self care tasks. Another option is state programs. And so there may be programs through your state's Department on Aging or Department of Disability and Rehabilitation Services that are designed to provide services in the home for seniors and adults with disabilities. Usually, these programs have some eligibility criteria, both based on physical need and potentially financial as well. But you can learn more about those through your state specific programs. Another option is exploring care through the Veterans Administration. If you or your loved one served in the armed forces, thank you so much. And you may be eligible for services as a veteran. And so don't leave those services untapped. You can learn more by contacting your local Veterans Administration office or contacting the VA's caregiver support line to get a better idea of how those services might work for you or your loved one. And then lastly, if we don't qualify for any of those other programs or those programs don't fully meet the need, then we're probably looking at paying for care out of pocket. And we'll talk more about how we think about paying for that care, whether we go through an agency or we hire someone directly, and kind of some of the considerations that might help you decide what is the most appropriate for my situation. So stay tuned for additional videos where we talk more about care and how we find it.